So let
Yes, I
everyone
think we
come.
can start, Severin.
So I will wait a few seconds. So I think we should start or wait for Benjamin. Benjamin, are you back? He let us know that he will come.
Yes, I'm back.
Yes, okay. I think we should start. Hello, everybody, because we have an ambitious schedule today. I welcome you to this part of the first International Caregivers Convention, and I'm very proud that we didn't let us discourage to do this. Also, the Corona pandemic stopped us in March to plan this big event. And we are very glad to welcome you to this webinar discussing about research on leaving care with researchers, traditional researchers like I am, and also researchers who are care leavers, who have a leaving care background. And I will not talk too much because we have many other speakers here. I just will let you know that my name is Severin. I'm from Germany. I work at the University of Hildesheim since about 10 years on topics about leaving care and child-induced care. And after Wolfgang introduced himself, we will lead you through this event. We will make a short introduction round with all of you.
Good morning. My name is Wolfgang. I'm from Germany as well. And together with Severin, I have the honor to moderate and to find through this morning or afternoon or evening, wherever you are in the world. And we are in a team researching care leaving in Germany and international care leaving. So I'm so happy that we can present today and that we have so many young and really good researchers about care leaving to discuss this together. And I hope that we will have some time to discuss, but it's quite ambitious to see the program and to see the questions. And if you have questions, please bring it in the chat, but Severin will say something about this as well. I'm really happy to be here and we will have really good 2 hours, I think. Severin.
Yes, thank you. For those who are for the first time in this room, you can use the chat, not the micro, but we made good experiences with this. If you like anything to know, if you have questions, or if you would like to comment something, put it in the chat. We will have a view on it and try to introduce it in the presentations. And we have also small parts between these presentations to discuss, I hope so. And now we would like to start with a small introduction part so that we know who is in the room now, where are you from, and what is your professional or personal background. So we prepared a Mentimeter questionnaire, a small one, and you will see the link on the next slide. So if you go to with your mobile or on a second side on your computer to this link, could you, Doro, could you go to the next slide? Then we could let all the people here know where you are from.
It's in the chat. You can see it in the chat.
Oh, it's in the chat. Sorry, I couldn't see it. Sorry. In the chat, you could see the link and the code, and we will give you 1 minute to let us know the questions which are asked there. So some of you write it in the chat. It's also okay. If you couldn't use Mentimeter, you also can let us know where you're from. You are. Oh, Brenda is also back from Ireland. I've seen you last week. Nice that you're here back again. We have somebody from Luxembourg, from Egypt, from Sri Lanka, Rwanda, Bangladesh. You see, people are here from all over the world. Zimbabwe, very welcome, from India. And on the Mentimeter, you could see now people from other countries who are here today, from Jordan, from Austria, from the United States, the Philippines. And why Germany is so big? Are we're the biggest group here today? I'm not sure. Yes, are we? So Switzerland, I could see also, and couldn't read. Small. Well, the colors are not easy to read for me.
Spain, Scotland.
Spain, okay.
And Scotland also.
Japan, wonderful.
Ukraine.
Jordan. Wow.
And the Netherlands.
This must be Martina.
But it's more than one because it's quite big written. Very good.
Yes.
Nepal also.
There are others here who write it in the chat. From Burundi, I could see people. So I think it's much more colorful than we see it on the screen at the moment. Thank you a lot for joining this. Do we also have the second question for asking who you are? So we have professionals here in the room. We have interested persons who like to know more about these topics. We have care leavers and researchers. And I think not all of them put it in the Mentimeter, so maybe the figures are not finalized at the moment. But it's just a small impression to know who is in the room now, who is in the world joining us, and thanks a lot for letting us know. So I think we should start with the presentation because there's a lot of content which we would like to share with you, and which we also would like to know because the presentations we didn't hear yet, and we split it into parts. The first part, about 1 hour, will ask questions about country-specific perspectives on leaving care. We will present a global research, and some people will present a research on leaving care from their home countries. And in the second part, we invited care leavers who did research themselves, and they will discuss with our different other issues on research on leaving care and about their own experience being part of research, or by doing research, what experience they made. And I hope that we can discuss about both parts, but everybody who is speaking beside Benjamin have 5 minutes. Benjamin has a little bit more time because he presents a global research, and that's why we start right now. We will change to the first presentation, and Benjamin still could let us know the context, who did this and when and why.
Okay, hello everyone.
Benjamin, you have still a presentation like that we see the other slides as well?
Okay, that's not my choice. I can't do anything about this.
Sorry, just, yes. No,
Okay, stop. I start.
Yes, I think you can start talking, and we hope that we can change the mode of the slides.
Okay, yes, I first introduce what I'm doing now, and yeah. Hello everyone, I'm happy to participate at this amazing global event. My name is Benjamin Strahl, and I'm researcher and teacher for social work at the University of Hildesheim in Germany. In my work, care living is one major topic for many years now. What I can be especially proud of is that I was involved when the German Care Leavers Association was founded, and I was able to network within its first and I was able to be part of its first steps when it was just a network. The study I'm presenting was conducted through an international team of researchers, me, Vardaman Feder from Canada, Adrian van Breda from South Africa, and my German colleague Wolfgang Schröer. Wolfgang Schröer, you already met as one of our hosts today. Unfortunately, Varda and Adrian are not able to be here with us today. Both would have loved to do so, but yeah, still they will present our findings together with me as they send videos, which we will see later on. Adrian is professor at the University in Johannesburg in South Africa, and like Varda, one of the heads of INTRAC, the International Research Network on Transitions to Adulthood from Care. Actually, this network brought us together as we all are members of INTRAC. Varda will introduce herself within the video now. She also will tell us something about the ideas of our study on international policies and practice of care leaving.
Hello, my name is Varda Manfeder, and I live in Montreal, Quebec, Canada. I'm delighted to be with you today. I wish I could be there live, but it's the middle of the night here. I am a professor at Concordia University in Montreal. And before that, I spent 30 years as a psychologist working in the child welfare system here. And a lot of the work I did was with care leavers. And in fact, right now, as we speak, I am mentoring a group of care leavers who have started the newest Care Leavers Association in Canada in the province of Quebec. So I'm very, very concerned about care leavers and spend a lot of time thinking about care leaving, and also have engaged in research with my colleagues, Dr. Stahl, Dr. Schroer, and Dr. van Breda. In 2016, we attended a FITSE conference in Vienna. And at that time, there was a special program for care leavers that accompanied the conference, so that 54 young people who had been in care from 15 countries spent those few days with us in Vienna. And not only did they make a presentation to all the researchers who were present at the conference, they produced a declaration with 10 standards that they believed should represent universal entitlements for all care leavers around the world. And it was an incredibly moving experience, especially because the things they asked for were really basic things that every young person needs to be able to succeed. And so this struck us as critically important. And we wondered, how could we as researchers support this initiatives and support the implementation of these standards, and also advocate for care leavers in a more, I guess, a more aggressive and energetic way than we had before. And so it struck us that we really couldn't even speak with assurance about which of these standards were already implemented around the world. And so we got together, the four of us, and built a survey that we hoped would, first of all, clarify what the status of care leavers around the world actually is, and then serve as a basis for advocacy, so that once we could identify where services were needed, we could really go forward and use the data to make a case for entitlements for care leavers, equitable entitlements. And as you're about to see in this presentation, not only were there significant discrepancies between what kinds of services are available and support is available for care leavers around the world, care leaving policy varies tremendously from place to place, and even within large countries like Canada. And so not only are there gaps in what exists, but there's a huge gap around the world in relation to what is actually provided and what should be provided. So I'm hoping that this data can really serve as the basis to go forward and press for change. I hope you enjoy the presentation.
Now see the declaration of the care leavers. Okay, you can find this declaration on the webpage of Vize, Inter as well, the International Vize webpage. Yes, and the music was a Vienna waltz because the declaration was made there. I hope you enjoyed it. Okay, now I get to some facts about the study. Our study was conducted by an online survey to carry international care leaving policy and practices. This survey covered 5 major topics. First, the general information about each country, like country name and political regime. Second, the administration of general child welfare policy. Third, care leaving legislation and policy. Fourth, the available services for care leavers. And fifth, the main challenges care leavers face in each country. The participants of the study were recruited through 2 international associations, the International Federation of Educative Communities, the Vize, and the African Network of Care Leaving Researchers, the ANCHOR. Altogether, representatives of 36 countries participated at the survey, 26 out of 39 Vize countries from all over the world, and 10 out of 11 ANCHOR countries from Africa. As I have no time to present all countries individually, just have a look at the map to get an impression. Okay, as I think you get the presentation, we can go on. And Adrian will tell us something.
We were interested in our study to understand the degree to which countries had legislation or legislative frameworks that would support young people in and leaving care. Our total sample comprised 36 countries, making up 100% of our participants. We asked these participants whether they had a legislative framework for looked after children, that is, for children who are still in care. A total of 32 countries indicated that they do have legislation for children in care. 4 indicated that they do not, giving us 89% of the sample reporting legislation for children in care. We asked those who do have legislation for children in care whether they felt that legislation was well developed or rudimentary. And we found that 23 of those 32 countries reported that the legislation was indeed well developed. 8 said that it was not. And so in total, 74% of the participants in our research indicated that they had well developed legislation for looked after children. We then asked the participants whether they had legislation that address the needs of children after having left care. And we found that 17 countries out of the 36 indicated that they do have legislation for aftercare. 15 indicated that they do not. And those 4 who did not have legislation on care also did not have legislation on aftercare. In total, therefore, we find that 47% of the countries that participated in our service report that they do have legislation for aftercare. Finally, in this section, we asked those 17 countries whether they regarded their legislation on aftercare as being well developed or rudimentary. And 8 of them indicated that their legislation was well developed. 9 said that it was rudimentary. Thus, in total, 22%, just under 1/4 of the participants in our study, reported that they had well-developed legislative frameworks for aftercare. What we see when we look at the numbers running down the left-hand side of the slide is a decreasing availability of legislative frameworks as we move from children in care towards children after care. Not only is there less legislative frameworks depending on these two groups, but we also find that when there is legislation, it becomes less and less well developed. This increases the vulnerability of young people leaving care because for the vast majority of them, there is an absence of legislation that speaks to their needs as care leavers.
Okay, thanks, Adrian. You can show all the items on the slide now. Thank you. Next to the legislation, we asked for the back, please. Yeah. Next to the legislation, we asked for the availability of support in each country. Generally, we were interested how long young people can stay in alternative care and up to what age support is available. For this, participants were asked to identify the age up to which support is officially available, according to policy or legislation, as well as how this works in practice. 1/5 of the countries, 7 countries, which are 90%, report that support is officially available up to the age of 25 or even 27 years. 5 countries report the availability up to the age of 22 to 24 years. 1/4, 9 countries, report that legislation permits remaining in care up to the age of 21, and in slightly less than half of the countries, support is available until the age of 18 years, which is widely regarded as the age of legal adulthood. However, the legal right to remain in care does not always translate into practice. While 1/5 of the countries allows support officially up to the age of 25 to 27 years, for less than 1/10, just 3 countries, it is reported that support ends at that age. This also applies for the age group 22 to 24 and for 21 years. For both, just 3 country representatives, 8%, specify that young people are supported in practice. 3 country participants report practical support for young people up to the age of 19 or 20, and in 2/3 of the countries, 24 countries, which are 66%, support ends in practice at the age of 18 years or even below. As you can see, there are huge differences between countries, but the considerable differences between the official availability of support and the practice of ending care seems to be a global trend. Next slide, please. In addition to the availability of support, country participants were asked if aftercare services do exist, and if so, to specify the services. In 24 out of 36 countries, which means 2/3, aftercare support is provided. This also means more countries do offer aftercare services than countries have legal aftercare frameworks. Maybe you remember just 17 countries have aftercare legislation. The most common services all over the world are connected to the labor market. Education and employment services are offered by 18 of 24 countries. This is closely followed by support services without a problem-specific focus. counseling, and supervised or semi-independent living options are available in 17 countries. Caregiver centers that provide a point of contact are less frequent and available in 10 countries, same as the provision of counseling opportunities related to problem-specific challenges, such as managing debt or housing problems. Therapeutic aftercare support is offered in 9 countries, and the possibility of moving back into care after leaving care, even at an older age, the coming back option, is available in only 5 countries. Next slide, please. Given the limited availability of support for young adults and the underutilization of options that exist formally, it is not a big surprise that caregivers worldwide face comparable challenges. Since in most of the countries in our sample, there are no official statistics or research findings in relation to caregivers, our findings reflect the views of our respondents and should be viewed as estimations based on their professional experience. The findings suggest that employment is seen as a main challenge for caregivers in almost all the countries surveyed, 34 countries, which are 94%. In 31 countries, education, housing, and poverty are perceived as main challenges, followed by isolation, loneliness, which was observed in 29 countries. In 3/4 of the countries, mental health is indicated as a challenge, 27 countries. Delinquency and substance abuse are seen as a big challenge in 22 countries, and teenage parenthood in 19 countries. What might be interesting is that challenges seem to differ not too much between the Western, Eastern, Northern, and Southern world. For example, countries that agree to 9 and more of 9 questioned challenges are, amongst others, Australia, Botswana, England, Brazil, Canada, Kenya, or India. Countries that agree to less than 5 challenges are, amongst others, Bangladesh, Denmark, or the Czech Republic. Next slide, please. After this focus on problems, I want to change the view for something more optimistic. We also asked about the existence of caregivers associations, caregiver networks, self-organizations, and so on in each country. We believe these self-organizations and lobby groups can make a difference in policies and practice for caregivers. We found that 19 out of 36 countries, 53%, reported having active caregiver associations. At the same time, 13 country representatives reported that there's no caregiver association at all, and 4 country participants did not know if such an association existed in their country. Next slide, please. It is great that more and more caregiver organizations do exist, but to fund these organizations seems to be a challenge. None of the care living associations gets wholly supported by the government, and all of them have to rely on multiple sources of funding. 15 out of 19 caregiver organizations, 79% of the countries with caregiver associations, get some funding from NGOs. 10 countries reported that some funding came from the government. 8 countries referred to private funders, and for 2 countries, it is reported that the caregiver organizations use membership fees. They get other unspecific funding or no funding at all. Okay, next slide. To sum up shortly, the study is just a beginning. It confirms that care living is a transnational and global challenge. Our international comparison points out the tremendous variations between care living policies and the availability of support worldwide. But it points out as well that caregivers are confronted with considerable social challenges all over the world. The results also highlight that despite the many challenges, caregivers have relatively few access to services. And moreover, legal entitlements are very often not put into practice. the overwhelming majority of youth in the transition from care to adulthood are left to survive on their own at age 18 or younger, even when legislation makes provisions for them to stay in care longer. To make a change, care-leaver organizations and other empowering actions like participatory research have to be founded, financed, and supported regionally, nationally, and transnationally. One key strategy for driving that debate might be the formation of an international association of care leavers that campaigns at a global level for reforms to promote optimal outcomes for youth from care everywhere. And I think this care leavers, or we think this care leavers convention might be the first step into this direction. Yeah, great to be here. Thank you for listening, and thank you for participating, and thanks for organizing this great event. If you're interested more into the study, you can find a publication.
Thank you, Benjamin. I could already start with two questions which we got in the chat. And one question is if you have any requirements about Burundi, and the other one came from Rwanda, if they took part in this this survey. And maybe you could answer on this.
Okay, so I know Burundi and Rwanda didn't take place. I'm not sure if they are part of the Anchor network. And if they want to be part of the Anchor network, it would be perfect if they contact Adrian Van Breda in South Africa. He's one of the heads of this network, or founder of the network, I think. I'm not sure, do you upload this presentation somewhere, or can it be found?
Yes, we will share these presentations. If you allow us, we could share this with all of the group and put it on the website. Or if you need further information, I think they could get in contact with you. Do you think there will be another survey like this? This one is from 2016. Will there be a follow-up, maybe with other countries included?
Yes, we hope so, but we have the same problem as the caliber organizations. We have to find fundings for this study because this was not funded at all. So it was just, yeah, because we were motivated to do this and did this next to our normal work. So we really want to do a more qualitative based study because this is just like estimations, and we had some limitations as well as in the study because sometimes it had been estimations and we got answers by 2 respondents from one country, and it was not, for example, not the same answers to some questions. Yes. So we really hope to go on and have a follow-up study, and yeah, if more countries participate, yeah, better.
Yes, if there aren't any questions, or maybe you could collect them, we would go straight ahead to the presentation of Maria, because we are just in time. I think it's good to let the rest of the time for the other speakers. Thank you, Benjamin, for this presentation.
Thank you.
Okay, so then I'll start. Hello from my side. My name is Maria Greunig and I'm from the University of Klagenfurt. And I talk to you because I worked in a research project where we did participatory research, and I was also involved in this in practical activities like in this international care leaver youth exchange in Vienna. And I also do teach about living care at the University of Klagenfurt. So can we go on with the slides? Okay. So first I want to say something about Austria, and about the child and youth welfare system in Austria. So in Austria, there are living around 9 million people, and 36,500 9 families got support with their child and adolescents in the last year, and 12,785 child and adolescents were in foster care and in residential care. You see the numbers below. And in Austria, we do have a legislation for young adults, but it's just between the ages of 18 and 21. And 2,048 young adults got support in the last year between the ages of 18 and 21. And 1,242 families got support when the children or the young people were between 18 and 21. So, and here you see the map and some specific pictures for Austria, which are really common. Exactly. So then we can go on. So then I want to say something about the research activities in Austria. And there we don't have that much research about child and youth welfare system, and there is even not much research about living care. But in the last years, we did a main study, and the topic of our study was formal education as perspective for caregivers. So the main topic was the formal education biographies of the young people. And the design of the study was that we had 2 complementary coordinated studies. One was a quantitative survey and a biographically oriented qualitative study. And the period, the time period of the study was 2016 to 2018. And it was founded by the anniversary fund of the Austrian National Bank, and also SOS Kinderdorf and Pro Juventute. They also supported the project. The project manager was Professor Sting, and I was with Wolfgang Hagleitner and Thomas Maran. We were the project team, and we also did participatory research, and we worked with 2 reference groups in Klagenfurt and in Innsbruck. And those people accompanied the research process. And yeah, exactly, we can go on. And I was told to talk about the idea of participatory research, and in our case, I need to say, we just did preliminary. We just came to the preliminary stage of participation, because the care leavers doesn't have decision-making power or co-determination in the research project. But they were for us really important reflection partners, because our idea of participatory research was that the perception of care leavers is strongly influenced by professional descriptions and institutional categories. So even researchers do have their peers and categories and descriptions. And so we thought, by including the perspectives of the care leavers during the research process, the field access, the survey, and the data analysis are designed to be more appropriate for the target group. And so we include the young people during the research project, and we made meetings with them, and we included their perspectives into our survey and also in the data analysis of the qualitative study. So the next slide. So, and then I was told to talk about the experience with and the consequences of participatory research. So, and in our case, so I think that at first it takes attachment and benefit for care leavers to participate in research projects. So this means they somehow need to have a benefit from this as well. And in our case, I think for them it was also interesting to talk about their experience and to be part and to be part of this process. So, and we also gave them money for participation in our research. Exactly. And another thing is that care leavers don't have that much time, because they are busy like other young adults as well. And so they do work, they study, they have families, they have friends, they have free time activities, and sometimes they need to deal with difficult life situations. So sometimes it's not that easy to involve them into into the research project. And another thing is that it's important for caregivers to speak about their experiences with independent actors. And this means that sometimes the people made good experiences in the child and youth welfare system, but sometimes they do not make that good experiences. And so they move away from the system, and they don't want to be in contact with this anymore. And so we experience that it's also important for them to talk about their experiences. And so even the interviews and the participatory group work has the benefit of a reflection space for the caregivers as well. So this is something, a benefit for them as well. And I also brought a citation from Robbie Gilligan. He's an Irish researcher, and he further contends that listening to children and youth in care is important because it's part of respecting their rights and dignity and telling their. So then to the next slide. And the last slide is about other caregiver activities in Austria, which take part in the last years. And I think I want to talk about them because they also try to participate caregivers in their work. And so we have one main thing is from the Austrian Confederation of Youth Welfare. They implemented a project called Welcome to Life, and this is a practical project where they try to implement supporting structures for caregivers. Then they also, in cooperation with FISE Austria, they also organized a structured dialogue. This was an Erasmus Plus project founded by the European Union between caregivers, experts, and policymakers. And I think from this initiative, the Caregiver Network Austria came up. So they somehow are coming out of this project. Then there is the platform 18+, and this is a platform where experts work on quality standards for child and youth welfare in Austria, and they also working on models for helping young adults. And then from FISE Austria and International, this International Caregiver Youth Exchange in Vienna, we heard about this, where caregivers developed these caregiver standards. And also SOS Kinderdorf of Austria do have their own initiatives, and they call their caregiver work Alumni Academy, and they also have a follow-up care center. And there's another association, Volkshilfe Vienna, and they also do have the caregiver mentoring. They implemented this kind of support structure. So this was from my side. The presentation. And on the right side, you see a few pictures from the caregiver dialogue, then from the International Youth Exchange, and also from the Caregiver Network in Austria.
Thank you, Maria. It's very interesting and very nice pictures. And if you have further questions, I think it could be good to write it in the chat. The F&A function is also fine, but I think not everybody could see the questions and answers, and maybe we could put them into the chat so that everybody could see the questions. And if there are further questions to Maria, maybe you. Thank you, Maria. And Benjamin, I think, is also answering.
Work in Wataniya Society for the Development of Orphanages. We are located in Cairo, Egypt. And the aim of the organization is to create a future of equal opportunities for all children and youth without parental care. I'll be discussing with you today a study that we conducted with youth who are about to transition from care. The age range was between 16 to 21. And the significance of this study is really youth at this particular time of the transitioning period, being the most turbulent time during the care leaving process. Next slide, please. And the context in Egypt is very similar to what Dr. Benjamin has said. But perhaps what is particularly significant, or what I would like to share, is that we cannot view youth transitioning from care without seeing all the socio-ecological layers and seeing this perspective, the individual level, the societal level, the community level, and the legislations level. Well, the context in Egypt is that there are child welfare laws. However, the aftercare system is still evolving. We still don't have we have a significant gap in laws and legislations concerning leaving care. But luckily, during the past couple of years, because there were strong advocacy efforts to really put youth transitioning from care and care leavers on the table in the parliament, talking about them in the media and discussing their challenges. So we are in this process. It's a long journey, but we are in this process. And the idea of why we see youth transitioning from care has to be seen from a socio-ecological perspective, because there are so many challenges and they're really interconnected together in the different systems. And seeing the challenges, a lot of practitioners and researchers get trapped in only the challenges, only the weaknesses, and stop seeing the capabilities and the strength of these youth. And from our experience, from the day-to-day experience we have from this study, we have seen that youth, despite all of these challenges, they have great potential, they are capable, and they are strong enough to change their own lives. They really are incredibly inspiring, how they cope, and how, no matter how adverse the childhood experience was, they are able to cope and transition successfully if given the needed resources. That's why it was important to really identify what were the factors that promoted their resilience. Next slide, please. And these factors are consistent with many of the research that has to do with resilience research across the world. But perhaps what's particularly significant to this particular group of youth in the Egyptian culture is that they were able to use whatever resources they had available, and the very significant finding that we found is that they got the opportunity to participate in their communities and start giving back. And this, at this point of stepping outside of their victim status, of the context of the social stigma, lack of resources, adverse childhood experience, they got an opportunity to participate and have a sense of social responsibility. And at this moment, they were empowered enough. This escalated their self-efficacy levels and made them feel capable of changing their own lives and the lives of others. So the other significant finding was this particular moment when they really stepped outside of their victim status and started giving back. The rest of the results were really consistent with other resilience research, but the main message I really wanted to get through in today's convention for everyone who's attending this webinar, be it researcher, practitioners, policymaker, a care leaver, someone who designs programs, is really to stop looking at care leavers and youth in care as weak or as incapable, because from experience, as all of you know, they are capable. They have enough strength and capabilities to really control their own lives and have an impact and change their lives and the lives of others. We just need to find out the resources that they need in order to support them to reach resilience and to reach this prosperity in their lives.
Yes, we see it.
Hello, everyone. It's such a pleasure to be here at this international platform, to be able to organize along with my partners from University of Hildesheim, from SOS Villages, from Kinder Perspective. This is like a dream come true. Here you can see on this slide, this research we conducted, which was called Beyond 18, Leaving Childcare Institutions. And we were very lucky because funding is always such a big issue, but Tata Trust and UNICEF, they collaborated and we could do it in 5 states of India: Delhi, Gujarat, Karnataka, Maharashtra, and Rajasthan. Before we get into the research part, I would just like to tell you about Udayan Care, the organization which I founded, and I am the managing trustee right now. 26 years, we have been doing child and youth care practice by running children's homes, because in India, foster care has still not evolved to that extent the way it is in the West. So there are 17 children's homes that we run and a very robust aftercare program. We have been advocating for the cause of care leavers in several conferences and consultations to develop a dialogue with care leavers on one side and practitioners and policymakers on the other side. We have also been doing a lot of research and publications, and I would like to, say that we are one of the first organization in our part of the world where care leavers were brought together and they formed themselves into an association which is called CLAN, Care Leavers Network and Association. We also formed an organization which is called Silk. Silk means, smooth sailing for leaving care. Youth who are leaving care, it should become smooth. So organizations like ours, individuals who are interested in the cause of care leavers, they could join together and help care leavers to develop their own agency. These were the research objectives of this study, which was conducted in 2018, presented in 2019. We wanted to check the relationship between life in CCIs. When you are growing up, what kind of background do you get? What kind of facilities do you get as compared to when you come out as a care leaver? What are challenges you have to face? And to understand the challenges, so we wanted to see what are the challenges based on all these 8 domains. And we wanted to see what were the promising aftercare interventions. We also wanted to know the data, which was very difficult to understand. In India, we have almost 10,000 NGOs and NGO run and government run childcare institutions. Besides these, there are many which are not even registered. More than 4 million children are residing in these homes. So it was next to impossible to get this kind of a data. We also wanted to develop measures what can help develop qualitatively improvement in aftercare activities and in the aftercare youth. So there was a lot of literature review, questionnaire, interview guides were made, ethics protocol were set, thematic framework, which I talked about. I will talk again, sphere of aftercare. We also used Mike Stein's resilience framework for developing our case studies and data analysis, interpretation, and indexing. We also wrote about the study limitations. We did a lot of, interviews as well as round tables, and we wanted to meet care leavers as well as practitioners and policymakers, because they have a different perspective. So if you look at it, 5 states, as I said, 100 key informants. These are members of CWCs, DCPUs, WCD, NGO leaders, child right experts. 435 care leavers were talked to individually so that we could get a clear understanding of where the care leavers stand in our country. And we developed 25 case studies. If you look at it, distribution by sex, 55% were male care leavers, 45% were female care leavers. As I said, in our country, there are more children's homes run by NGOs. Almost 91% are NGO run homes. So 48% children were selected, youth were selected from government run CCI, and 52 from NGO run CCI. We also looked at the aftercare status. How many got aftercare and how many didn't get aftercare? So if you look at it, non-receivers were only 27%. So you would wonder, then the aftercare is being given to the youth in a very good way. But when you look at the data, you will realize that why we could get only 27% non-receivers, because others were not even available. Nobody knew what happened. No data was maintained of theirs. This is the sphere of aftercare. And if you look at it, there are 8 domains: identity and legal awareness, housing, independent living skills, social support and interpersonal skills, emotional well-being, physical health, education and vocational skills, financial independence, and career. We came to these 8 domains which you can see like pieces of puzzle. They are interactive, they are interdependent. And after doing a lot of literature review and talking to all these youth as well as the functionaries, we realized these 8 domains are most important domains on which, while the child is growing up in a childcare home or even when he goes for aftercare, these are the domains where he must be served. Here I have only a few findings which are quite startling. So if you see, 67% caregivers were not even aware that they have a right of aftercare. So when youth don't know that they have a right and they are being treated as, a charity object, how would they fight for their rights? Housing, half of them, they did not even have any housing support. I'm sorry. They did not even have housing support. Independent living skills, while you are at the child care home, you are not taught any living skills independently. You can't go out on your own, you can't cook, you can't wash, everything is done for you. So they were not ready for independent living when they leave the child care home. Social support, they have a very confined world and they don't get a lot of interpersonal living skills. 61% faced recurring emotional distress, these youths told us. 78% did not even have any health insurance. So you can imagine how their physical health could be in jeopardy. Education was really in a very bad state. 40% could not even complete schooling by the time they were 18. Many dropped out, and 2 out of every 5 required training in life skills and vocational skills. 48, if you look at the financial independence, 48% had no independent source of income. Average monthly salary was 7,500 to 8,500, which is not even within the minimum wages. 33% were not able to cover their living expenses. Only 7% are self-employed out of these. So this study was really an eye opener. It created evidence. It created, it generated evidence for the policymakers, for functionaries like us, practitioners. And we developed a whole lot of recommendations based on this research study, where some were on the national policy that they should be recognized as a distinct category. They should be given, there should be policies for them for education, skilling, employment, housing, and health. So this legislative framework for aftercare has to change, and they have to be given individual aftercare plan, a single window support system. We also talked about there are very good laws and policies still in India, but they are not implemented. So we looked at, how do you implement the existing policy and law in aftercare in a better way? There has to be a greater investment. The children, all these youth have to be served on the domains of sphere of aftercare, and there should be capacity building on transition readiness while they are in the children's home, so that when they come out, they are able to live life on their own. They must know their legal rights, and a gender neutral approach has to be there, and data has to be collected, and MIS has to be created. We also gave some ideas how can linkages and convergence can come between different ministries and departments, and how the care levers could be collectivized. If they are collectivized, they develop their own agency, they develop a peer network support group, and they also can be a great resource to the policy makers. So good news is, after the study came out, a lot of stuff has started happening. Many states, they've started writing out their policy guidelines for aftercare. The investment has also increased in many places. And the greatest news is, which I came to know only yesterday, one of the state governments has come forward to collectivize youth of their state into a collective. So more than 350 youth are being collected, and it is a state-run initiative. So all the 5 full state reports and a synthesized national report is available on this website, which I have written here. Since the time was given to me, only 5 minutes, and I think I have eaten into a little bit more time, yet I had so much more to say, which, I would like you to read the reports and understand. And if there is any question, I would be more than happy to, to talk about it. So one of the care levers said, we had to deal with pain after transitioning, and I take it as my responsibility to make that difference for future generations. And I'm proud to say some of my clan members are also present here, and all of them feel that whatever it is, they have to make things better for other caregivers who will be coming out tomorrow. Thank you very much.
Thank you, Kiran. Yes, it's really a pity that we couldn't go deeper in the research of all of you who have presented now. I think that's very difficult now, but I hope that these are good appetizers to discuss more about research on leaving care. And I hope this first hour showed you that research is not only a job of academics and very dry. I think we could see that research is important to empower people, to empower care leavers to be active and to fight for their own rights. And I think for us all, it is important to do research, to advocate young people, to go on a national and international level in discussion with politicians, with professionals about the things which have to be changed. And somebody wrote in the chat that there are many similarities along different countries, along different systems and cultures, that the results of leaving care, the outcomes are not very well yet. And I think this convention is one of the activities to change the situation. And now 1 hour is over and we have 1 hour left, and I'm very glad that we could go deeper in some parts of research from people who are in a double role here now, who are care leavers and researchers in the same persons. And these are also small impulses to let you learn more about research. And we have 6 people on the list who will let you know about the research they have done. And we will start with Fabienne from Austria. And I welcome you. I haven't seen you on the screen this morning, but I hope that you will be here and talk to the audience. Thank you. Is Fabienne online? I'm not sure. I haven't seen her. That's why I'm not sure if we could start with her part. Does anybody know? Maria, are you involved?
I didn't talk to her, so I don't know.
So otherwise, I would go further to Purnima because she has a very long part. And if Fabienne is online, she could give us a sign and then we will go back to her slides. But if she's not here yet, we would go on further with your part, Purnima. I think there's many content in it. And yes, you have now the time to present your research. Thank you.
Thank you so much, Severin. Good afternoon from India, everyone. This is Purnima Jindal. I work with SOS Children's Villages International with their International Office for Asia as the youth regional focal person. So I'm responsible for the entire youth care and development in Asia region. So very glad to be a part of this webinar today and to be sharing some of our area of work that we did in order to understand the perspective of young people, especially during this COVID-19 period, and how we can support young people moving forward and help them plan for better transitioning. So quickly to tell you what SOS Children's Villages is all about, we work in many different ways to meet the needs of children and young people. We serve young people we serve, and this includes strengthening families, providing with alternative care, child, youth, and mental health development, youth employability and participation, education and development, emergency responses, and many more. Hence, SOS covers the entire care continuum from prevention of child family separation to alternative care to aftercare. Uh, moving forward, can we have the next slide, please? Yes. So if I talk about the the our approach towards youth development, that includes shaping a range of quality youth care, supporting young people's mental health and well-being, facilitating young people's access to quality education and skill development, preparing and accompanying each young person on their individual journey to independent life, and also simultaneously training care professionals to help young people transition smoothly to their independent lives. So in the same context, we were trying okay, somebody's asking me to reduce the speed. It was just on because of the time constraint. I was going a bit fast. Anyways, I'll try to be a bit slower. So yes, so in the same context, we reached out to our young people who are in our care from nine different countries in Asia to learn how they are coping with this COVID-19 pandemic and how they are planning to become resilient during this period. So it was basically a purposive sampling wherein we reached out to the young people of SOS Children's Villages, and also between the age group of 14 to 24 years. 728 young people in all participated in this survey. We also reached out to the volunteers and mentors who were supporting these young people during this crisis situation and helping them develop their skills. So in a total, we reached out to 93 volunteers comprising of corporate volunteers, individual mentors, and SOH educators. Yes, so as we all know that, this COVID-19 pandemic has produce significant interruptions in the life of children and young people. It has put into question their transition to higher studies, employment, and also to economic and financial independence. And it was really important to understand their perspective, to learn about their fear and apprehensions, and start guiding them properly towards a better tomorrow. Can we have the next slide, please? Yes, so I will quickly share some of the major findings of our survey. So first, to talk about major fear and apprehension. So what we see that almost all the young people who responded to this survey were fearful about some or other regions. There were only 2% who were still very positive, and they were showing resilient and trying to be coping with the pandemic quite well. Otherwise, young people were worried about their education, especially the delay in their exams and the semesters. So as we all know, it was during March when most of them were appearing for their board exams, and everything was put on halt. So they were quite worried about it. One out of two, that is 50% young people, also recommended that there should be, strong measures should be taken for better healthcare reforms, because they were actually anxious about their well-being and about being infected from the coronavirus. Also, one out of three young people wanted better economic reforms, better job opportunities, and scope for business, because they were anxious about leaving care in such a situation. Moving forward, we also try to learn. No, no, I mean the same slide, please. The previous slide. Yes. So we also try to understand the lifestyle challenges that came up with this pandemic, and almost like 4 out of 6 young people shared that they missed going out, and they were like missing mingling with friends, and going to schools and things like that. Wearing masks, social distancing, frequent hand wash, these were some of the recently adapted lifestyle changes. 4 out of 5 young people felt that face-to-face education and training sessions are still better choice, and they would definitely like to return back to normal as soon as possible. Yes, as we know that the entire system went on digital because of this pandemic. So we tried to learn about the internet connectivity challenges, and we understood that 43% of young people mentioned that they attended their virtual classes daily, while 36% mentioned that they were attending it several times a week, and 21% shared that they could only attend with the proper arrangement. So whenever there was an arrangement, they were able to to take their classes and learn things online. 89% young people reported that they have access to one or more electronic devices. Out of them, 39% mentioned that they had access to common desktop. So yes, there was a challenge of having, unique connecting devices for all the young people responding. Also, 11% of young people said that they don't have access to connecting devices as well. Also, 50% of the young people shared that they had reasonably good internet connection. So this was also basically because they were staying at SOS Children's Villages, and due to connectivity and also digital devices available for the young people and the children. Next, we also thought about how young people were developing their skills during this pandemic, and all the 100% of the participants, they mentioned that all of their coaching and skill training came to an halt because of this pandemic. 50% young people were attending English classes or computer courses during this time. They engaged with online classes and also to engage themselves productively during this pandemic. And yes, they reported that over 70% of young people were one of the children's villages. 20% of young people were entrepreneurs. So moreover, they were really job situation would not favorable, so they were really looking for entrepreneurship training modules, and also they wanted to have workshops as well, through virtual interactions on social media. So these were some of the key findings from this study. Should we move on to the next slide?
Should we go to the next slide? Punima, your sound is not so well. Maybe you could put your camera off. That could be helpful for hearing you better.
Okay, so so this is what we could conclude from this study, that we took way forward for young people planning to leave care in COVID-19 era, and what we kind of tried to analyze our findings on five key aspects. The first was ensuring mental health and well-being of all the young people who are planning to leave care. So it is really suggested that young people take up psychological first aid training or any kind of mental health. If they are facing with such challenges, they should speak about it, and they should take proper care of their mental health. Young people should also attend COVID-19 awareness training program, and kind of understand what are the effects that it has on the health and economy, and also the recovery mechanisms, so that that builds confidence in them. It is also suggested that young people take up sports activities and yoga sessions so that they have a healthy mind and body. Young people should limit their use of the time on social media, because we have seen that children and young people, they really spend their time, rather waste their time on social media, and that also creates panic in their life. So they should limit their uses of social media and concentrate more on reading books and newspapers rather. Young people, the second aspect was participate actively. Young people should mobilize their energy and passion to support COVID response initiatives. They also either should participate in some of the youth led initiatives in their region, or maybe start their own youth led initiatives. Regarding digital infrastructure for education continuity, yes, young people should avail uninterrupted high speed broadband connection, so that they have sufficient ICT equipment also to attend their education and training. If possible, young people should be supported with extra allowances for getting some extra mobile data, so that they can continue their education. They should explore online courses and develop their employability skills, and young people should create their profiles on all leading job portals and platforms in their local area. Next, we talk about partnerships and networking. Young people should connect with government relief program, because government across the globe, they are coming forward to support the communities and also the young people. So we should learn what exactly are the benefits that is being catered to our group and try to connect with the government relief programs. Young people should also connect to local employers and avail internship opportunities. They should also connect to industry mentors and also to leading manpower agencies. Last is about the skill development for employment. Young people should prepare their own individual development plan and monitor their progress, keep a check on the rising and the falling industries during this COVID-19 period, and also align their choice of higher studies and skill development accordingly. Also, creative industries like mobile applications and content development will provide better job opportunities. So they should start thinking about getting themselves trained in those areas. Digital literacy would be really very important. Explore the possibilities of technical and vocational educations, entrepreneurship opportunities, and also attend career guidance webinars and sessions to understand what is the what is coming up in their own communities and in the local areas in terms of employment and self-employment opportunities. So this is how I quickly conclude the findings and the way forward of the study that we did in Asia region, and it was in the month of between the June and July, so that we understood the perspective and we can guide our young people and prepare them better to leave care in a post COVID-19 era. Thank you so much for listening patiently. Thanks a lot.
Please. Yes, thank you, Purnima. I got a call from Fabienne at the moment. She was not in time here, and I said it's okay because we have many other speakers here. And she sends you many greetings. And now we have some time for questions left in the chat. Purnima, if you like to have a look at the chat, if there are questions. I think it's a very important part which you have shown us. I think the pandemics are like a magnifying glass to show, to express the situation of youth in many countries, and especially the situation of disadvantaged youth like care leavers. They suffer from the disadvantages of the pandemics more than others. Like in Germany, we did a big research. Many politicians doesn't talk about this. They talk about economic questions and other questions, or how to get young people back to school. But they don't ask about their mental health situation. Yesterday evening, I had a workshop with young people who let me know that they really suffer from their fears about their futures. And I think we have to put it in the middle of the discussion that young people are in a very difficult situation because they don't know what will happen the next month, and how the consequences will be for their whole life. And that's why your research is very important in this actual situation.
Thank you, Severin. Thanks a lot. So there's just one question. Was this research exclusively for SOS Children's young people? So yes, it was conducted with the countries where we work with our young people and our children. So it was done exclusively for SOS young people. So thank you.
Yes, but like we have seen, these questions are universal, not only for people from SOS villages, but also in other residential units or foster families. And yes, I was asked if leaving care is a female issue, because we have so many women who are speaking here at the convention, but I think it's a question for everybody, and it is not less important if many women are engaged in these topics. But now we come next to somebody who is talking not as a female, but as a man from California, about his own experiences and his research he has done with his PhD about living care. And I welcome JP, who's sitting at night in the United States with many other important topics at the moment, but he took his time to let us know about his research, and I'm very happy that you're here now to introduce us into your research results. Thank you.
Thank you very much, Dr. Thomas. Hello, everyone, wherever it is that you are in the world. My name, as Dr. Thomas mentioned, is John Paul Horn. I go by JP or Dr. Horn. I not by choice. People just end up calling me Dr. Horn after I got the doctorate. For my PhD, in order to defend my dissertation, I had to launch my own study. And one of the things that I was most interested in were really sitting with care leavers like myself and asking them what their vision for their future looked like. I think so many of us who grew up in foster care in the United States had a lot of adults tell us what they thought our vision for our futures should look like. And I really wanted to hear it from the other people who had left care. So I started my research project with two very simple questions. How do care leavers define success in their own words? And what kind of resources do they need to help them achieve it? In order to do my research, I did in-depth qualitative interviews with 15 care leavers from all across the United States who ranged between ages 22 and 29. I did this very intentionally because in the United States, we do a lot of research on care leavers who are between the ages of 18 and 25, but we don't do a lot of research on older care leaving populations. And a lot of this has to do with how policy works in the United States. So there's just a very narrow age range around child welfare policy in the US. So I wanted to see what kind of struggles or what kind of successes people were having as they got older. What I found was that success was defined either as an achievement-based idea, so getting a good career, attending a good school, establishing these goals that they'd set for themselves and that they were able to achieve. So it was always something that was related to either employment or education. I found that it might also have been life satisfaction based. So things like leading a good life, leading a happy life, not having as much stress in my life, not overcoming the trauma of my past were things that I'd found in my work that care leavers had defined as success for them, or that their success for them was connection based, build a family, connect with other people, connect with my faith, all sorts of things that were very much around just connection. And individuals didn't have just one definition of success. Many of them had a combination of ideas for success. What I also found, and what may be not as surprising for people who do a lot of research in this field, is that resources to achieve success were very scarce for people who left care. Even though the United States has wonderful aftercare programs, a lot of the care leavers just described that in their experience, they just weren't able to access them. That even though they were told that they were plentiful, the way that they're funded and how little funding is given to those resources mean that they have to compete with other young people who are leaving care to get access to those resources. And so many of them are put on long waiting lists or never actually get access to the resource. And if they're age-based or age-limited, they may end up aging out of the resource before their name is called on that wait list. And the biggest thing is that the barriers to success were very much related to growing up in foster care. There were a lot of rules that were developed that prevented them from seeking employment during their time in care, or seeking volunteer opportunities during their time in care, or even developing relationships and friendships when they were in foster care. And this is important because in the United States, one of the things that we look for in terms of outcomes for young people leaving care is whether or not they can gain employment or establish healthy relationships or seek educational opportunities. And when the rules of your foster care system actually prevent or prohibit or discourage those young people from participating in those activities, you actually are creating conditions where those young people don't get to meet those outcomes and don't get to achieve the different types of outcomes you're hoping for. So if we can advance to the next slide, I just want to talk a little bit about things that I learned from the Life After Foster Care study. The most important thing I learned is that care leavers want more research on their strengths and less on their deficits. A lot of people were very appreciative that I was asking questions about what worked well in their lives and very open-ended questions that allowed them to talk about things that were good for them before they talked about their barriers. I also need to tell you that you have to be very careful how you name your studies when you participate or do studies. I actually started this as the Success After Foster Care study, and I got feedback from people. I'd only had 3 people volunteer to participate. And I said, you know, what do you think is keeping other folks from participating? And they said, well, you say success, and not a lot of us feel successful. So we want, you know, you might need to change the name, because you're not actually asking about, you know, what it takes to be successful. You're asking about what we think success is in our lives. And so I renamed the study to be maybe less ambitious in terms of what it was called. And the last thing I'd leave you with is that we still don't have a lot of research on middle adult care leavers in the United States. So in the US, we don't know what the long-term effects of foster care are for people who grew up in our foster care system. And one of the big things that I saw when I was trying to collect data for my study, whether there were just a large number of people interested in participating who were over the age of 30, and I had to restrict the age group of my study. So my next study is going to be working with people who are over the age of 30, because we do need to know more about what the lifelong impact of foster care is on people who experience it. So thank you very much for inviting me, Dr. Thomas and everyone. And I am happy to answer questions in the Q&A if people want to put them in there or even in the chat.
Thank you, JP. That is a very important message, I think. The period of leaving care might end sometimes, but I think we learned that being a care leaver will not end at the moment when the leaving care process is over. Many of them have to cope with the results of leaving care their whole life. And also your first message to focus more on the strengths of these people, so they have many aspects of resilience in their backpack, and this is also a message to research more on these positive sides they take with them from child and youth care. And maybe I think we are good in the timetable. There's also time left for questions or maybe a short discussion, which we could introduce now. So I invite you to ask questions, maybe also to the other speakers, if you like. So we could have a look at the chat. Maybe I could ask a question. How did you find the people you asked in your research? Because we know from our research that it is not easy to find people from foster families. Care leavers from foster families are not so easy available because they are not so well organized, or they are not so good professional networks which we could use to find care leavers from foster families.
That's actually a wonderful question, Dr. Thomas. I use social media to source my participants. It turns out that there are lots of different organizations on Facebook in the United States where care leavers talk to each other and get mutual support from each other, and develop the connections with each other, and exchange resource information. And I always ask the moderators of those groups, I identify myself as a care leaver as well. So I say, I'm a care leaver, I'm doing this study, would it be okay? And often they will say either yes or no, or ask me more about it. And I think it's important to always ask permission in those groups, because it's such a vulnerable population, even if they are adults. And the moderators don't always want the group to be bombarded with requests. And I had a great relationship with a group for years, for 5 years. And I asked if I could post my study in the Facebook group. And I was told no, even though I had been part of that group for a long time. And I respected that, because I think it's so important that people honor those types of barriers and that kind of professional boundary. The other thing I wanted to mention is that, I think Dr. Modi's presentation and my presentation are really kind of indicating the same thing, that the foster care systems in a lot of our countries are not preparing our young people for adulthood in very successful ways. And if nothing else, foster care is designed to keep you safe until you reach adulthood, and then prepare you for adulthood so that your own children don't end up in foster care. And in the United States, and I know in many other countries, that's not necessarily what happens. And I think we need to have that larger conversation in the world about how it is that our governments are not preparing our young children for adulthood when they're the ones taking over their care. So I thank you so much. And I'm so happy that other people are doing work like this.
Yes, there are many people in the chat agreeing with you. And I think also the others who are in the room here think the same like you think. And I'm always impressed about the similarities between the different countries and continents. And so we will change now the continent. And I ask, sorry, my throat is a little bit difficult. I asked Khadil to introduce us in her results from Jordan. And maybe we get some other impressions about leading care from your side.
Yeah, hi everyone. Thank you for having me as part of this important webinar. My name is Hadil Amairi from Jordan. I am the Senior Communications Specialist at the Information and Research Center of the King Hussein Foundation. Our slogan is Mobilizing Knowledge for Positive Social Change. I will talk to you briefly about our participatory action research with care leavers that we implemented in 2014 over 3 years with the support of FHI 360 and the USAID, and in partnership with a small grassroots organization here in Jordan that supports care leavers. So the goal of the project was to identify and reduce the legal and social inequalities and discrimination faced by youth deprived of family ties in Jordan who are or have been residents of care centers or orphanages, and provide caregivers with a support system to alleviate challenges inherent in transitioning from alternative care to adulthood. I found that there are many similarities in the findings in comparing with your research. The methodology we used in this project and most of our projects is very participatory inclusive research methodology. We use a mixed method approach, including qualitative peer research with the youth deprived of family ties, as well as quantitative research with society members. Next slide, please. So we started with a desk review, including literature, legislation, and media review. Then we gathered a team of 12 care leavers, 6 males and 6 females, to prepare them to become a peer research team that would later conduct data collection with other care leavers and in-care youth. And they did that with 19 care leavers and 22 in-care youth, as well as prepared a survey which allowed us and the research team to consider challenges as perceived by the research participants, the youth themselves. And there were 18 participants in this survey. After that, we conducted the society survey, and we did that, not the research, not the peer research team. And it aimed to assess and explore the manner in which Jordanian society regards different group of youth deprived of family ties, including youth whose parents passed away, youth from broken homes, and youth with an unknown parent. And this survey was completed by 600 participants. On the other hand, it was important to use a theoretical framework that takes all variables into consideration, and hence the selection of the social identity theory. Based on the research finding and the theoretical framework, it was clear that youth deprived of family ties in Jordan belong to a group in society that has a negative social identity. And the two main issues creating and feeding this identity are the social stigma and their unpreparedness to leave the care centers. Or to leave the care in general. So the discrimination they face is a social one mainly, because we were referring to them as illegitimate or of an unknown origin or founding, and this was clear in the results of the peer research and the society survey. Also, this is an issue that's been back and forth between the UN Committee for the Rights of the Child and the Jordanian government, whereas the committee kept recommending that we refer to them as born out of wedlock, but in the Jordanian context and Arab context in general, it is just a discriminatory. So in our peer research, the peer research team, when they carried out the research with their peers, they decided that they want to be known as orphans, and then to be none more specific than that, to be referred to as deprived of family ties, which is more dignified and more respectful. So legally in Jordan, they have no issue. They are recognized and have full rights, but because they are deprived of family ties, they are often socially discriminated against, as well as they have their own challenges because of the circumstances they're raised under. The second component of the project was awareness and advocacy, where we used the findings of the research to mobilize the key stakeholders in order to create positive social change by reducing the social discrimination faced by youth deprived family ties in Jordan, and to change the way this group of youth was perceived by society. So the awareness and advocacy campaign incorporated a variety of activities, including meetings with the government, a play called Born to Be, where the script of this play was developed by the caregivers themselves to reflect the challenges they face, including education, work, accommodation, relationships, and marriage, and etc. Also role-playing with caregivers, raising social awareness of all forms of discrimination through traditional means and social media, replacing the discriminatory labels to describe this group, and finally establishing the first national network of civil society organization, which provides services for caregivers in Jordan, along with building the capacity of a group of the members of the network on case management, skills, referral mechanisms, and other useful tools. Also developing a caregiver kit, which was developed by the peer research team and the network members, and it was attached with a card of the main and important phone numbers that they can call to get some support if they need, and it provides caregivers some information to start an independent life upon graduation. Thereby, the youth were effective participants throughout the research, advocacy, and awareness components, which gave them a sense of empowerment. And as a result of our campaign, we are happy to say that we are no longer hear a lot of discriminatory terms that we used to hear before. Thank you.
Thank you, Hadia. I could go further to one question in the chat. How many care leavers are getting what kind of support from the Kind Hussein Foundation in Jordan? Could you answer this question?
Okay, for this one, so we for the research, because it's just a research and we are as a research center, we're just conducting research. We don't support care leavers directly, but through the network up until now, since 2018, when the network came to life, and up until now, we have supported I think 69 care leavers here in Jordan through the referrals between the members to provide them with the needed supports.
Okay, thank you.
Thank you.
Are there any further questions? I think it's a very different access to these topics. It's very interesting to have so many focuses here, here in the space. So are there questions, or we will keep them to the end after we had the final presentations of Katharina and Tanya? Both are from Germany, but worked on different issues. So welcome, Katharina. She is a former colleague of mine. She studied at the University of Hildesheim, and her master thesis she did on the topic of leaving care. She's working now in the field of residential child and youth care, so she didn't left the field. And she came straight ahead from work at night, and I hope you're not too tired at the moment to do your presentation for this group.
Yeah, thank you so much, Severine. I'm Katharina. As Severine said, I studied social pedagogy and organizational studies at the University of Hildesheim, both a bachelor's degree and a master's degree, and I just finished my master's degree. And I'm a care leaver myself. And in my studies, I have worked in several care leavers projects. I haven't prepared any slides, I'm sorry for that, because it just came from the night shift. So I can talk a little bit about care leavers' perspective in working in care leavers projects and research projects, and also the results of my master's thesis. Yeah, so before I graduated, I worked in a care leavers project focused on counseling of kids in higher education, where we also did some research and tried to focus on reaching care leavers wanting to go to higher education, especially in Germany, because we don't have many research results on that topic. Yeah, so we had some counseling and some online, like an online counseling approach, and also did some research on the topics that came up from the care leavers who contacted us. So that was very interesting, and also led me to finding my topic for a master's thesis, where I interviewed 5 care leavers, or I could use interviews that had already been taken at the institute in Hildesheim. So I analyzed 5 interviews, and I also analyzed the literature from Germany and the current research on the topic. So I focused on the transition from children care to adult to independency.
You're interrupted sometimes, even if it's nicer to see you, but maybe you could put your camera off, maybe then it's more stable.
I will.
Thank you.
Okay, so I hope it's better now. My main focus was the transition from child and youth care to independency. So I mainly had a focus on when did care end, at what age, and how it was connected to the transition to other support services, and what what was the experience of the care leavers in the transition and afterwards? Where did they get support, and did they feel comfortable, and did they feel well prepared? So it's very interesting to have the findings that the lower age and the people that they felt prepared for an independent life. And also very interesting because it's been a topic that has been going around in the German research was the connection with education. So very interesting to hear for me the previous presentation today, where it was focused that skills are like basic skills are not always prepared in the care settings. In Germany, we have main focus on those skills like washing, basic skills like clean, all those things. They are addressed a lot in the transition process, but what we lack in Germany is connection to education in some care settings. So finding of my master's thesis was if the support is through the whole education process and first qualification or through graduation from high school or any other high school, and the transition is to the till the job. Sorry, I'm just trying to read the questions. It is more successful. So if care leavers are supported through education, in most cases, the outcome was a better outcome. So they had less financial problems. They had less problems to enter the to enter work or find a position, find a career. So that's very interesting. And also that the transition mostly based on becoming.
Sorry, Karina. We get the note that somebody can't really hear you because you're interrupted very often. I know the results of your research, but maybe we could you go closer to your router, for example? Is it possible?
Yeah, I can try.
Sorry for this interruption.
I'm very sorry.
Include a question.
Is it better now?
Yes, I hope so. I hear you clear now. Maybe we could try it once again.
Okay, I'll just try to outline the main results of my study, which was education on the one side. The education is very important. The longer the care system tries to stay in touch with the care leaver and supports education, the more successful the care leavers are. And another very interesting finding of my study was that the focus in Germany is a lot on becoming independent, but it's not about the independency as itself. So what is also important to learn where it is important to be independent and on which topics it is important to be interdependent. So to learn which ties need to stay and which ties could be cut off and you can become independent. So it is important to get the support systems, to build up a network of support systems, because it cannot be the main goal to be completely independent without any support, but the focus should be which support do I need, where do I get it from, and to focus on the resources and not on the deficits as we had already in most of the presentations today. So it is very important to support and empower the care leavers to, on the one side, focus on their resources and try to become as independent as they can get, but on the other hand, offer them support services, offer them support systems, and try to connect them to the support that they need and support them all the way through education, all the way to getting a job, and until what I think is one of the most important things, that support and care should end when the care leaver themselves feel ready to end it, and not on a specific age, not at a specific qualification. It should be a process together with the care leavers and the social workers. So much for my study.
Thank you, Katharina. This is a very strong statement, and I know that you're also a very strong person. Could you at the end maybe tell us one or two aspects besides the structural perspective, what leads care leavers to be successful in education? Are there main aspects? What could you let us know? What is helpful for care leavers being successful in education, and especially in higher education? Did you find it in your results?
It's the structural barriers on the one hand, as in Germany, higher education, if you want to reach higher education, you need support above the 18th birthday, because it's not possible to get a high school diploma setting you up for higher education before you turn 18. But on the other hand, it's I think what's very important is focus on the resources and empower the care leavers that they are capable of higher education, or they are capable to achieve educational goals that they set up for themselves. So yeah, it's basically focusing on the resources, and the social workers looking at the care leavers individually and not just as a group which just needs to have some kind of qualification, but to look at them individually, what kind of qualification they want to get, and support them all the way through.
Thank you. I would emphasize your position with a cite from the chat. Here somebody wrote, we overemphasize on independent and ignore the useful social ties. I think this is also a very important aspect. To have good social networks will help leaving care and being successful in the life which comes after this. And before we will come to an end of this second slot, we will show you a short film of a care leaver who also did research on a special aspect. She comes from Berlin, but couldn't join us today, but she sent us a small video of 3 minutes. And after the 3-minute video, we will sum up this webinar today. This is Tanya Abu, and she will introduce herself right now.
Hello, everyone. My name is Tanya Abu. I am super thrilled to be joining the convention and I hope that next time I can join outside video. I was told I have 3 minutes, so I have set a timer. I'm joining the conference from a triple perspective, which means I am a care leaver. I have spent a big part of my growing up in residential care in a residential care facility. And I'm a social worker, which means I now work with young people in residential care. And I did a research project on young people in care that had a bit of a very large subtitle. The project itself is named Alternative Future, and the subtitle is Towards the Empowerment of Children Victims of Violence in Alternative Care through a Gender-Sensitive and Child-Centered Capacity Building Program for Professionals. That's a mouthful. But I'm going to break it down in the 1.5 minutes I have left. We basically did focus group interviews with young people in care and with social workers who work with them on their understanding of violence and violence that they experienced, with a very broad understanding of violence. And from the interviews, we did a workshop program. Like, we drew the main points from the interviews and from our findings. And we found that there was a huge normalization of violence amongst young people in care, that a lot of violence that they experienced was, and so we made workshops for the young people in care and also the social workers. And in the end, we put everything in a best practice catalog that is also translated into English. And I will send a link to the catalog with this video. And yeah, I am looking forward to meeting you all and discussing in digital person. Bye.
Yes, thanks a lot to Tanya. I think violence in child and youth care is also a very important topic, which we haven't discussed so many till yet. And so this is an important project. And I think it's nice to have a document of her project in English, which she will share with us. I don't know if Dorothy will put it in the chat, the link, or otherwise we will share the document on the homepage. Yes, we did a large and quick run through many projects and perspectives, and I will invite Wolfgang now, who saw the whole presentations with us all, to try a short sum up before we end with a small Mentimeter request. If you enjoyed this presentations with us, and we will share the links for the next events of the Care Leaver Convention in this chat with you, to remind you that this is not the end of the convention. Yes, and I will give Wolfgang now the time to try a short sum up or view what will go on now with all the results.
Thank you, Severin. And I know nobody in the world can do a sum up of these brilliant presentations, because they were so wonderful. And the best sum up of this event is in the chat, I think. If you see this chat and read what the people wrote, you can see the main points. And the main point is the strengths of the care leaver, and that we need more research of young people doing this and bringing different questions up. You know, on my paper, I have so much written down. This full papers of what I have now in my head and to think about. And on the one hand, it's so brilliant to be together here and to see how, in the presentations of Katharina, when the internet wasn't so good, people were trying to sum it up in the chat. I think this is a really good thing of a webinar. People are helping each other, supporting each other during the webinar, and to bring us together. And this is the interdependency we have together. And on the other hand, it's a pity because I would like now to go in different groups to meet you like we wanted to do it once in a big conference, to speak and to discuss the different things with all of you and the different presenters. I think even on the people, the 100 people who are in the room, they want to discuss this now with all the ones who presented. So we can't do this, but we have a kickoff that we will do support together and that we will do all the questions we have mentioned today. And I think we should carry on and we should meet. And I think that our friends in India will help us, that we will come together and we all together. So Severin, I can't sum this up. It's not possible, but I know it's not good to sum it up. It's good to open up and to open up all our questions and to go on and to bring up more research that will help to now in the situation of Corona, to help to bring better circumstances for all of us and for the care leaver. That would be really good. And we will do together. So Severin, do the end because it's already 2 minutes over the time. And we are Germans and Germans stay always for this, that we are in time, but it's okay. Sorry, please.
Yes, maybe this is a wise finalization of this meeting here. We will, Dorothy will include the Mentimeter link that you can send us final comments and feedbacks about this webinar today. And we will include, I have to search for the link to this this document Tanya was talking about. We will send a link also that you can have a look at this English document as well. So we finalize this round with some links and options of feedback. And I thank you very much for joining us, for presenting and for sharing ideas and perspectives. And I hope to meet you for the next pre-event in, I think in 2 weeks, is it right? And the main event at the end of November. You can find all the dates on the website. And now, Dorothy, will you share the Mentimeter link with us to finalize this session?
It's already in the chat.
Okay, sorry, I can't see it. Maybe I'm blind for the moment, but if everybody sees it, it's fine. So maybe we can get for the final screen to see what the feedback shows us. So here you see some results. Thank you for sharing your opinions with us. Yes, and some write in the chat. We keep this and hope that you enjoyed the different topics. And I think we could finalize that we will not stop with this, what have been done, that we will go on further. And we hope we could make a convention sometimes to meet everybody who's in the room here in real life. So we close this session with these impressions of remarks and feedbacks. And I thank you very much for being here today, and wish you a good day or a good night wherever you are, and say goodbye for the convention team, and hope to meet you next time.
So all the participants are requested to please attend the pre-event 4, which is happening on 21st November. Look out for the website. Thank you very much.